Hello everyone, I'm Arun Sharma, from MPH student from JD University, and today I'm going to talk about infection control in hospitals. So first, let's understand what infection is. So an infection occurs when germs enter the body and increase in number and cause a reaction of the body. And these three things are necessary for an infection to happen. And in healthcare settings, infections are a very serious concern because in hospitals, hospital acquired infections, also known as HAIs, pose a significant risk to patients and also to the staff who are working in the hospitals. So, these infections can have severe consequences for the health of those receiving care because if a person is already sick, if a person is already suffering, then that person because of the infection will have more trouble and will take more recovery time to recover. So one fundamental aspect of infection control is proper hand hygiene, like washing hands. Like a healthcare worker should wash hands properly, the floor should be wiped properly, the equipments that are used to diagnose or to treat should be properly sanitized, and even the patients also, they should wash their hands properly, and after going to a hospital they should wash their clothes. They should not reuse those clothes. First wash and then reuse those clothes. And doctors should also doctors and staff should also use personal protective equipments, also known as PPE kits, to safeguard themselves and patients. Also, how can we prevent the spread of infection? So isolation precautions are key in containing infections. Different type of precautions like the contact, droplet, and airborne are used based on the nature of infection. So for example, as we know, in COVID time we didn't know what kind of infection it is. So what we did, like we used to wear masks. We didn't like we used to maintain a 6 feet 6 meter distance and all of other things. So there are many precautions for different kind of infections which should be taken care both by patient and staff. And also isolation rooms are specially designed to minimize the risk of infection transmission. Also, vaccination plays a crucial role in preventing certain infections among healthcare workers and patients. So there are many vaccinations available. For example, COVID. We have vaccination for COVID also. There are many seasonal flus and many diseases for which we have vaccination. And infection control is an ever evolving field. Like first, in earlier times, we only used to like clean with water. Then we started boiling equipments and clothes, and then we have chemicals and autoclave and other things. So healthcare staff undergoes continuous training to stay updated on the latest practices, and hospitals adapt their infection control measures during outbreaks and pandemics. And there are many research and guidelines to further guide their efforts to keep everyone safe. And as a patient or a family member, you can also contribute to infection control. It's not like it's only the staff's duty. So you should stay informed about your care and ask questions. Uh, from the healthcare provider and the staff, you should ask questions about infections and other things. And practice good hand hygiene and follow hospital instructions. When you enter in the hospital, there are different kind of rooms where there are different kind of methods to prevent infection. For example, when you go to ICU, you have to put on other shoes. When you go to OT, you have to put other clothes. So follow all the instructions that are provided, and we all share the responsibility for a safe hospital environment. It's not the job It's not only the job of hospital staff, it's also the job of hospital patient. And if infection control is a collective work and effort, and by working together, we can ensure that hospitals remain safe spaces for healing and care. Thank you.